Welcome to the Heart of Healthcare podcast. I'm Hallie Tecco.
I'm Michael Esquivel.
And I'm Steve Krause. And every Monday, we bring you the latest in healthcare innovation as we sit down with entrepreneurs and industry experts.
So buckle up and join us as we figure out how to improve healthcare for all. Hello, listeners, and welcome back to the Heart of Healthcare podcast. I'm your host, Hallie Tecco. In the 1990s, HHS Office of Women's Health started National Women's Health Week to highlight women's health issues and encourage women to prioritize their physical, mental, and emotional well-being. I don't know if anyone else noticed, but the HHS website has not been updated this year. It's still showing last year's information. But we still wanted to fully acknowledge and honor this week and really the entire month. So today I have two colleagues with me to talk about all things women's health and digital health. First, welcome Katie Drasser, who is the CEO of Rock Health. She recently co-authored a report on understanding women as digital health consumers, which is linked in the show notes. Katie, thanks for being here.
Thanks for having me.
My second guest is women's health founder and advocate Carolyn Witte, who founded TIA, the leading tech-enabled primary care provider for women, in which I'm a proud investor. Carolyn and I recently collaborated on a piece around the growth funding cliff in women's health. Carolyn, good to see you as well.
Great to be here, Hallie and Katie.
Good to see both of you. Happy Women's Health Month. It's May. Katie, let's start with you. In your recent report on women as digital health consumers, what are some of the key findings on how women are engaging with digital health?
Thanks, Hallie. Thanks, Carolyn. Well, Hallie, as you know well, as the founder of Rock Health, for 10 years, we've been running the Consumer Adoption Survey to try to get a sense of how people in the U.S., people living in the U.S. are using digital health. What are we building for? What do people want? This year, and we use that as sort of a national baseline, right? It's census matched by age, race, ethnicity, income, et cetera. It gives us a sense of what, where our starting point is. This year, we took a really close look at women as consumers in digital health, given all the energy that's gone into women's health. And what we found is the majority of women are really using digital health. And so specifically, we've got 54% of women track their health metrics. 51% say they're willing to share their health data with a provider, with family. 56% have used virtual care over the last year, and 52% own a wearable or connected device. So the majority of women are using digital health. Now, the devil's in the details and sort of the nuance by age, by race, by all kinds of things of where there are differences, but that's the basic picture. I think one of our conclusions from that report, and it's more so of a question, which is if women are the super users of healthcare, the power spenders, the super users, the decision makers, then why aren't those numbers higher? And I think as Carolyn well knows, there's so much latent opportunity that remains to build for more women better. So
did you walked away feeling like the numbers were not as high as you thought they might have been?
Yeah, I would say that. I think there's just a lot of room to grow. I'm surprised that many of them weren't higher, and yet women are using it. The majority of women are using it, right? So it's they're showing us they want it, but we think the number should be higher. Yeah.
How does it compare to men using digital health?
It's an interesting question. So in some cases, it lags slightly behind men. In some cases, it's fairly even, but it hovers right around the way men are using it. I think one thing we thought about, and it's more of a question, which is, are men our benchmark? And I would presume, this is now me, Katie, talking, not necessarily Rock Health, I don't think they should be the benchmark, given what super users women are and the decision makers and all of that, caregivers, et cetera. I think women should be super users of digital health. And I suspect that a lot of the innovations haven't yet reached a bunch of women, or we just could be building better and building more great companies like TIA and others that actually serve women well. And I think if we were serving them better, they would use it more. And so that's a challenge for us. That's a fun challenge for us to take on, which certainly this trio of women do every day.
Carolyn, how does this level of adoption check out compared to what you've seen at TIA? Yeah, I think it's really interesting. And I would say surprised by some of the results as well, Katie, but I think kind of your framing of it is what's the right benchmark is the right one. Maybe to zoom out a little bit first, I think just to reiterate kind of what you said, women are the super users. Women, when you look at healthcare more broadly, not just digital health, women can use and consume healthcare, so to speak, at much higher rates than men, particularly in our reproductive years. We use healthcare 2 times higher, services, so to speak, 2 times higher than men do. And that translates to more dollars. And then there's, of course, the caregiving piece. So we all know those stats. And I think it's important to like almost pause and double click there and say the healthcare system was designed basically for men, yet women are still the biggest users, even though it's not designed for them. Then you like layer in to go deeper into looking at digital health and virtual care and wearables and all this sorts of stuff. And these are, I would say, kind of a new class of products, some of which have been more thoughtfully designed for women. And I would say some of which haven't. And that's where I think kind of the nuance is. But we saw, in my time at TIA and, what I've seen looking at women's healthcare more broadly is when it comes to kind of modern healthcare, virtual care, next gen tools, women are eager to use them. They're eager for experiences that are designed with them at the center. Women, from the onset of COVID, women tended to be the bigger users of virtual care as compared to men. However, in my experience, women want virtual care that is a complement or an extension of their in-person care experience. It's not it's not going to solve 100% of their care needs, and they want it in a way that connects to their real world care journey. As an example, they want digitally enabled tools and they want to be able to track data and share that data with their provider, et cetera, but they want it to provide real value to them. They want it to be, they want to trust it. They're concerned about privacy. They have all these sorts of things that maybe might be a little bit more nuanced and different than how a male patient may think about some of these tools. So I think kind of the takeaways are there's big opportunity here, but I think the right benchmark is how we think about women, also not as a monolith, but different groups of women by age, et cetera, and how women might use certain features. So menstrual tracking or cycle tracking is obviously a great feature for women of a certain age group. But what about when we get into menopause and postmenopause? How do we think about adoption of different tools? Similarly, around virtual care and in-person care, the usability of those types of experiences, I think, differ across different ages and so forth. So I think if we start to shift from just men versus women and looking at to a more kind of personalized care model where we think about how do we build and design tools with women at the center, but women of different ages, women of, in different chapters, and actually build products for them, we'll see even more adoption and hopefully better outcomes too as a result.
I can't help but think when Apple launched the health app years ago and had tracking of everything from asthma and medications, but they somehow missed period tracking, like the one thing that has probably been tracked longer than any other biometric. For millennia, women have been tracking their periods. And I think that was really telling of how women are often an afterthought in these products. And there was a lot of outrage, a lot of commentary around it. It was almost like comically bad that it was missing from Apple. Do you feel like and that was what, 2013? Do you feel like we've made progress since then in terms of meeting the unmet needs of women in digital health?
I do think the tide has really shifted there. If that was I don't think anyone, maybe not anyone, but most major players, I don't think would launch a product today without thinking about how do I at least consider the needs of women. This is due to the rise of the category, people actually understanding the market opportunity. And I would say regardless of even just any, it's the right thing to do. I think business leaders across the board recognizing that building for women is smart business. And so we see, I think, these women-centric features starting to take center stage, whether it's in wearables, like Aura being kind of a great case study of a product and a company that has really centered women's needs in the last couple of years and seen that drive massive growth in business results. Their business has quite literally flipped from being predominantly male to predominantly female. And that isn't because they kind of added some hacky cycle tracking features. They actually really centered their entire product and org chart and business from, my digging in.
They have a women's health team now.
It's amazing. Yeah. And I think they're really a model of how to actually really center your product around the needs of women and build a really authentically powerful product that women want to use and drive business results. So I think that's kind of a great case study. And I would say Apple as well. I think it's interesting, they had that big flop, when they first launched that product. But today, I would say their cycle tracking features and a lot of their women's health features are are really kind of leading the category a bit. So the tide is shifting in my experience. So Katie, I'm curious to hear what you think too.
I think that's right. And I think the national baseline we find feels tremendously low. We found 5% of women are using these rings like Aura. I think innovators like yourself and the folks behind Aura show us that the ceiling is much higher. And like, that's what we should be aiming for when we design better. Women still lag behind men in using these things. Interestingly, they still do a lot of tracking, Hallie, analog. It's worked for centuries to track analog. Yeah. So like that will be like turning that tide. It is about many things. And
I'm just trying to understand, do they have like physical calendars? Like how do people do this today? Like
that would be something we should dig into. We didn't ask, what exactly are analog. I think it's just writing it down. And I think, and other sorts of hacks. I do think though, I mean, this is where I think there's room to grow. We found that women, the number one thing they track, and this might be one of those passive tracking things, given how the devices are built, but it's heart rate, then physical activity, and then menstrual cycles. So those are the top three of what women track, and then they track a whole bunch of other things. But some of that is based on how the product's designed and what it's sort of passively tracking. And so it'd be interesting to see over time, like, what gets priority in tracking. I think the menstrual cycle piece will go up among other things. So
here's my hot take. I think the more we like figure out how to actually make data like that shareable and useful in a clinical context, and actually enable women to share that data with their provider, not in like some export to PDF, like attached to message in hope that a provider reads it one day, but like, you can imagine what that would look like. I think that's really, and actually making that usable in a clinical context, that's how we're really going to get adoption of those features amongst women. And I think also see the differential impact when it comes to health outcomes and actually better diagnosing things like PCOS or endometriosis or menopause onset or whatever it may be, based off of data like HRV and cycle data and so forth.
I think the integration is key. I think the other piece I would add to that is trust. And so what we found in the data is that women are, again, super users of searching online for information, but they don't trust it. So only 7% of women trust completely what they find on, social media apps, et cetera. Where we do find trust, interestingly, are places like Reddit, where they're connecting with other women. Or if you have a company like Tia or Midi or Health in Her Hue or whatever, where you can connect with other women, that's where trust gets built up, or connect directly with a provider you trust. That's where the trust starts to build. And so I think there's a room to grow both on the integration side and the trust side to actually overall, not just grow adoption. The other thing we care about is like, it's one thing to adopt, it's another thing to engage. And how do we keep growing that in more meaningful engagement, not just like signing up for the thing, but actually growing that engagement. And so I think the trust the integration piece you talk about paired with the trust is really important for all of this.
And actually, I think having some skepticism about things that you read or see on social media is actually quite healthy. Yes. So happy to see that people are consuming things and questioning, do I believe this or not? And then kind of bringing it to a more of a group of women that they trust to discuss. Would love to see that also extend to providers, but know that they're just generationally, there's less trust with providers now for younger women, which is unfortunate, but something that I think a lot of digital health companies can kind of build into their offerings. So lots of opportunity there. I wanted to talk about something I've heard you mention before, which is this concept of designing for the margins. What exactly does that mean for women's health, and how can companies operationalize that idea to truly serve this population?
It's one of the things that excites me most about digital health overall is there's really no reason in this day and age with the technology we have to not be more precise in how we're addressing all kinds of needs, identities, demands. We have the technology to do this. And what we find, I think what often happens is like we do this sort of design for all, but what it actually is design specifically, designed for specific needs and populations that just have a different set of, for all kinds of reasons, needs, interests, demands. So one of the things we found in our data, for instance, is Black women are some of the highest and fastest adopters of digital health. I mean, that's remarkable, way higher than their white peers and other women of color. So 65% compared to that sort of hovering around the 50% of what I mentioned earlier, those margins. And I think with that, they're signaling strong, engagement despite these standing inequities. And I don't need to tell you two know this well, but part of why that demand is so high and the usage is so high is because they can find more tailored care that actually meets their needs on a variety of things that they might not find in their hometown or in their neighborhood or with whatever services they have access to. And so we often look at this like these are not passive groups sort of waiting to be reached. They're active consumer bases that are sort of ready for these tailored high quality solutions. And I think that's where innovators and founders and startups and other folks in this space have a lot of room to play. And I think there's a business opportunity to design for folks who are actively raising their hands to use all kinds of these tools more. And in this case, Black women, but you can say this about all kinds of populations who are demanding this stuff and want something just a little bit more tailored and different. And we can do that.
So do you build many tools for different populations, or do you have one tool that is flexible enough that it, like, let's say Aura, for instance, which has been flexible enough to really speak to both men and women?
I think it depends. I think you could build many tools or you could build a flexible enough tool. What I would say is who is at the table designing these things? And that's something we are obsessed with is who's funding this and who's designing this? Who is actively designing how these tools are built, rolled out, and what's the feedback loop to make them better? And I think, again, with technology, there's so much room to do that. There's really no excuse to not do that, quite frankly, at this point. And so it's a matter of prioritization. Yeah. It's a matter of how you do that from the beginning and not just as an afterthought at some point during the innovation cycle.
Well, I would say one excuse is that a lot of the investors would say, is that a big enough market? How big is your market? Can I invest in this? It doesn't have venture scale. That's something that women's health founders face again and again. Carolyn, you built and led one of the larger women's health startups. I'm not sure how many times you probably heard that. What are some of the other kind of challenges that those in the space face in terms of getting to scale or the perception that it can get to scale?
Yeah, so I think the good news, let's start there, is that I feel the world's kind of finally woken up to the size of the women's healthcare market. And I would say people care, so to speak. They're paying attention and they care for all sorts of different reasons, but people care. Women's health is on the map. And it's kind of, we've kind of broken through the women's health is niche kind of misnomer that I would say dominated the first, my first decade of working in the space.
Yes. And I think that you're the third person to be on this podcast more than once. Congratulations, by the way. But I think that the title of the show that you were on was Women's Health is Not a Niche. And that was probably 3 years ago.
For sure. And the tide is definitely turning there. And I think is something to celebrate in real momentum. Spent my first many years building Tia, just trying to convince the world why we're quote, cutting out half the population. And that serving 51% of the population with 80% of the dollars was a big enough market opportunity. So people get that, whether it's investors or CFOs of hospital systems or health plans or whatnot. I think the tide has turned there. So that's great. Now, I think the challenge and the opportunity is actually how do you actually give the companies who, working in the space who've proven to the world, this is a big market. I have an awesome product that women want and need. I actually have a business too, with real fundamentals there. How do you actually give those companies more firepower to scale? And that's where I think we're seeing quite a gap, and gap as we have all these relatively new, let's call it, women's healthcare companies that have been founded or built within the last 5 to 10 years, so to speak, that are growing up, and now they need real momentum to scale. And this is key for, I think, broader impact in terms of women's lives across the country and the world. This is key for founders and also funders in the space who are looking to say, hey, women's health isn't just a moral and imperative, but smart business. Investing in women's health is smart business and drives big outcomes and big returns. And that full kind of life cycle and seeing the impacts of that life cycle in terms of improvement of health outcomes, but also return of dollars, I think is what we really need to drive the category forward, and kind of giving these companies the firepower to scale is really the next frontier.
Yeah. And you're talking about, when we say scale, it's not the 0 to 1, it's the 1 to infinity. So it's like we probably have a good number of companies with a sub $100 million valuation in women's health. How many do we have above that?
Yeah,
you and
for
I
sure.
know the answer to this. Not a lot.
We'll get into that. Yes, not a lot. And I think we think about it both in valuation, but then I think as another proxy in terms of like lives they serve, and in terms of actually what, you can only serve so many women in terms of particularly direct patient care if you like without real capital. Yeah. If you look at kind of total dollars that are going into the category and even the biggest players in the space, how much money they've raised relative to broader digital health and healthcare companies, it's a fraction. It's a drop in the bucket. And so to get to companies that can actually serve tens of millions of women in terms of like, on a daily, weekly, monthly basis, we need to actually give these companies the ability to kind of cross the chasm, so to speak, from that 0 to 1 or post product market fit. I have a strong business to a massive business that can serve women nationwide and even globally.
Yeah. Katie, you've worked with so many women's health startups over the years. What do you think are some of the biggest challenges that they face today?
I think the obvious one is funding, because it's not just the funding of the startup if you're a founder of one of these companies. It's the chronic underfunding of the innovation ecosystem that you're building off of. And so we know that women's health research, for instance, has not just lagged in terms of funding, but lagged in terms of like the longevity of the data, the specificity to the study of women, et cetera. And so that's just a research component in addition to sort of regulatory things, et cetera. And so you're building off of a chronically overlooked sector, and then you're chronically underfunded. We know from the data, Rock Health data, that even if we have a growing amount of money going into women's health, the size of the rounds are smaller than sort of general digital health rounds of general digital health companies. And so you're getting less money, less of the pie and less money on top of an innovation ecosystem that has been overlooked and underfunded. And yet all these founders are building on this and doing a fantastic job of it, quite frankly, given those circumstances. So I think it's like a challenge on many challenges, but a challenge on a challenge to build in this space. I would say the upside is you have the most motivated set of people at the table to do this. So many of us, we're just three of the many, whether it's investors, founders, other types of innovators that are massively motivated to do something about this. And so that is some real sticking power that isn't going away anytime soon,
Yeah. So Carolyn and I recently published and co-authored this article based on Rock Health data, and I will put it in the show notes, but it's on this concept of the growth stage cliff, basically how women's health companies don't just get a small sliver of overall digital healthcare funding, but really that funding that does exist is concentrated at the seed and Series A stage, with very few beyond that, including, I think we counted 5 that were Series B and beyond in 2023 and 2024 combined. Just 5 companies raised a Series B or beyond. The rest were all Series A or seed. Carolyn, we frame this women's health funding challenge as a kind of this flywheel problem and not just the funding gap. Do you want to talk about the cycle?
Yeah. And I think it's important to talk about the cycle, both, I'll speak mostly from the kind of founder perspective, but it also is impacting the funder side. And this is where there's like this kind of vicious cycle that's holding the whole category back that we really need to break. So to start at the beginning, I think it's helpful to kind of break it down step by step. And the first step is a little bit of what Katie, you were saying, and Hal, you were saying. Women's health is on the map. There's more dollars going into the category than ever before. About 6% of VC dollars, I think, in 2024 went to women's health, which is
digital health. VC dollars in digital health.
Digital health. Thank you. Important distinction. 6% of VC dollars, digital health dollars went to women's health last year, which is an increase from the year before, but from my perspective, still not exactly where we need to be. But nonetheless, it's positive momentum. Yet the bulk of those dollars at their seed or Series A stage, this is, in large part due to a rise of kind of newer funds, often led by women or gender lens specific funds or women's health specific funds, plus some generalist funds making bets in the space. But there's a whole bunch of new, call it 0 to 1 stage women's health companies tackling the space. The problem is those companies then grow up, and what is not really talked about is they're actually competing against each other, not just in terms of like CAC and users and things like that, but then actually for dollars when they're trying to break through that Series A stage, let alone the growth stage Series B plus, which we'll get to in a moment. So it becomes more competitive. Then there's less dollars at the Series A, but especially beyond, to actually fund those companies once they have product market fit, a real business model to back, and actually giving them that dry powder to really scale. And this is where we see this massive just cliff in terms of fall off of capital, with less than 5 deals, across Series B plus in aggregate in the last year, which is really just like a tiny, tiny, tiny drop in the bucket. And so what we're seeing is these companies get stuck, and they don't have the same access to capital to grow like other digital health companies do. And as a result of this further compounds in terms of the lack of exits and lack of kind of return on capital to those investors who need to show their investors the ability to drive returns when investing in women's health. And then the cycle continues. And so this is the kind of growth stage cliff and the broader kind of negative flywheel I think we're seeing in the women's healthcare category that's holding women's health back. If you dig a layer deeper and ask, okay, well, why aren't women's health companies at the Series B, C, and D really getting as much capital? I think the answer, I think, speaks to the flywheel. There's no comps. And when I say comps, what I mean is like comparison companies for women's health investors to look to point to say, if I invest in XYZ company, they're going to drive this return just like this other great women's health company that's really scaled. And this is kind of the double-edged sword of being an early mover in kind of a nascent category and trying to create a category that didn't really exist. If you look at the public markets, there's actually only one company in the public markets, Progyny, that is a quote-unquote women's healthcare company. And they're really a benefits manager. And that's not even, in my opinion, the best kind of, it's an apples to orange is comparison at best to the vast majority.
Services.
It's not healthcare services, right? So like comparing a Tia to a Progyny or a Midi to a Progyny is a stretch, if you ask me. And then even when those growth stage investors try to look outside of women's health and say, I'm going to try to compare one of these companies to another, call it digital healthcare company, they're having challenges too. And this has to do with the lack of exits, that digital health has faced overall in the last couple of years. And so it's a women's health specific problem that I would say is compounded and exacerbated by the challenges in digital health overall, but it makes the underwriting of those growth stage investments challenging for investors and funders, investors and funders, and then impacting the founders as a result. And so this is a cycle we're looking to break to really help more of those awesome companies with amazing products that women love, with great businesses break through, get that scale, drive those returns, and kind of build those case studies that the market needs.
My message to any investors that are listening in is stop being so obsessed with comps. I think that it is a fake way to build conviction. History will not tell you how things are going to go moving forward. Looking at the lack of women's health companies that have exited over the last 10 years is not going to tell you how many have the potential to exit in the future. In fact, if anything, it could be a sign that there's such a big underserved opportunity because there aren't these national, scaled brands. But investors are just so obsessed with this, like, what are your exit comps? Like, how can you compare? Which I think doesn't do anyone any service, because I think it's a way to build conviction that is rooted in the past and not what's possible. And then the other thing that we should just add to this that you and I kind of debated a lot in this report was like, how do we untangle all of these concrete issues with the fact that there's also a gender issue here, that the majority of women's health founders are women. And so just having, women get under 1% of venture funding. So we are also facing just being women founders with also very few women VCs to write the check. And it was something that you and I, we touch upon in the piece, but how do you untangle it from these other pieces?
It's hard to disentangle. We know but it is absolutely I would say both things can be true. We know that the vast majority of women's health founders are women. They get kind of this double whammy of bias, so to speak, and this lack of comp issue in women's health, the lack of comp issue in terms of pattern recognition, in terms of women founder CEOs, that compounds to make the access to capital more challenging at all stages. I would add one thing to that we also know is true from the data, which is if you look outside of women's health and look at women's founders more broadly, women tend to sell more of their companies in each stage as compared to men, which I think is another factor that you can't ignore when you look at how selling more of your company at each stage compounds when you get to the growth stage and what that means for women founders at the helm of these companies. So it's a complex story, but I think important also to recognize, I think, and not conflate the differences between what absolutely exists still, which is bias from a fundraising perspective, gender bias, et cetera, from not kind of, I would say, get our wires crossed, so to speak, where there's like business fundamental issues there. Because the reality is what we really need is women's health founders, men and women, building awesome women's health businesses that can deliver great, incredible value to women and drive returns. And we need to be able to do that while objectively pointing out the biases, but also objectively recognizing where there are, business fundamental challenges that I think get kind of wrapped up in some of these gender, bias conversations, and I think can hold the category back too. So both things can be true.
Yeah, I would say that some of the smartest investors I know see lived experience as a competitive advantage. And so if you see lived experience as a competitive advantage, then you would want more women at the table, whether it's on the founding side or on the investor side, to move farther, faster, and to have that deep commitment and understanding of what women want and where the demand is and the nuances of it, given what we were saying earlier about like it's in the nuance that we're going to unlock whole categories and take this to scale. And so I think from an investor perspective, that's what I would advise is like, how are you prioritizing that? And that's a competitive advantage that I think will bear out in the next, decade or so.
Yeah. Of all of the challenges that we discussed, Katie, what do you think is, if possible, like the most solvable of them? The lack of comps, the lack of exits, the capital constraint of the small funds, like all of these issues that we're discussing.
One of them was this size of the round and not getting sort of enough money in each round. That feels very solvable to me. So I would it's like, check your bias. Like, why are those rounds? And I would put that on both founders and investors and everyone in between. Ask for more, make sure you're asking for enough. That to me feels like one that's very solvable. You're already at a yes. How might we grow that and make sure we're actually getting the capital we need to build these innovations? That feels like one. Yeah. I do think changing up who's at the table, it's not an easy challenge to solve, but it feels like one that we're right on the brink of changing. That's what we're seeing, and that's what we hope. Yeah. But that one feels like one we could do something about, and many people are trying.
Anecdotally, it does feel like the multiples that women get in terms of revenue to valuation are very different, and in women's health, very different. There's almost like a penalty for being in this industry where you could have like very strong revenue, but like you are still getting lower than average multiple on your valuation. And I think just like maybe recognizing that and discussing that so, we can change that would be a good thing. Carolyn, what about you? What do you think is most solvable?
Ooh, I think the biggest thing that I'm focused on right now is really helping, I would say, kind of two groups of people, both dedicated women's health founders and other companies that might not have been founded as, quote, women's health players, but are making active investments in building women-centered products to build better products that serve women. I think when we broaden our lens of how we define women's health and beyond just a product that serves women only to 51% of the population, 80% of the dollars, it actually can allow us to say, to solve this comp issue, to solve the market kind of TAM niche issue that we were talking about earlier, and ultimately deliver better value to women. When I think about what I hope the healthcare system or digital health kind of ecosystem might look like in 10 years, it's that every company effectively should be a women's healthcare company in some way, shape, or form. And if founders think about it that way and investors think about it that way, that gives us a broader lens to look at and say, here's this clinical trials company, here's this wearables company, here's this medical adherence company, and 50 to 75%, I would get 80% plus of their users are women, and they're the most active users of their product, and they're driving this much revenue and this much of their bottom line. And that's a women's health exit we can point to. That's a women's health success story. And these are more women, on the as end users of these products getting value too. So to me, it starts with building awesome products that authentically and serve the distinct needs of women. And we're centering those products from the get-go, kind of leveraging that lived experience that you talked about, Katie, whether it's, of founders and bring more women founders to the table, or kind of women leadership, women designers and builders at all levels, helping them build amazing products, demonstrate the kind of business value, and then help kind of the broader category see that every company is and should be a women's healthcare company. That's how we have broad-based change across the healthcare system overall.
I love that. I love that because instead of right now, there's this like one and done mindset in women's health investing, and investors that aren't women's health investors specifically are like, oh, I've done my women's health deal. Like, I'm an investor in Maven, like, and any company that then pitches that investor, they're like, well, why doesn't Maven do this? And there's this whole epidemic within investing where they feel like they've checked the box. But what you're suggesting is like, if more companies take this lens and more companies become women's health, then you're not putting everything into like this box. It's like everything needs to be serving women.
Yeah, I ran into this all the time in my past life. And I would love to say, I would love a world in which, every woman has Maven as a benefit from her employer, and like comes to a TIA clinic and uses her Aura ring. And then like, you know what I mean? Like all these things can coexist and be true to drive real amazing outcomes for women as users and patients, but also for the investors on the other side. So the idea that like I made my women's health bet, I often say like, can you imagine if an investor, we said like I made my enterprise SaaS bet and like I'm done.
My AI bet? I already made my AI bet. Sorry.
Exactly, right? It's not happening. And so I think if we broaden that lens and remember that again, 50% of the population, 80% of the dollars, women are not a monolith. We have a lot of needs. A lot more needs than men when it comes to healthcare. There's all the data there. Then that allows us the mindset to back more founders and products and businesses that can and should coexist together to help the category kind of rise and progress forward.
Yeah. Yeah. Katie, your take on all this?
I would just build off that to say what Carolyn said. I completely agree, and would say that as a result of this, what happens is we massively underestimate the ROI of women's health. We do this over and over again. We just massively underestimate it. And I think where tech comes into play is I think tech has an outsized role to play in reaching some of those chronically underserved folks, in personalizing the care so that we can grow this scale, the reach, the impact of all these innovations. And so that's where I get excited about tech. And we know from our data, like there is so much unmet demand here. So if you pair the tech and the unmet demand and then really start to think about the ROI way differently than we have historically, all of a sudden you can see the business opportunity here. And it just, to me, feels like a slam dunk. And the more people who can see that, I just think we can keep pushing forward in a way where this innovation actually produces real outcomes for women, where women actually like enjoy their healthcare experience. There's so much room to grow here. That's where I get excited about this.
Totally. My advice to any founders or potential founders listening, Carolyn Leslie Schrock did a series on venture funding in women's health. And I do think that there are ways to grow. We've been hearing more about seed strapping. We've been hearing more about bootstrapping. If there is a way to build your company without venture capital, do it. You don't need to depend on VC in order to build a business. If that ends up making sense for your business, go for it. But otherwise, like that shouldn't be the determination of if you get to build something or not. But there's such a need for your work here. So please do it. Maybe we can just close if each of you want to give advice to any founders or potential founders listening.
I can start. So to build on what you just shared, Hallie, it's, focus on building an incredible product and incredible business. And if you do that, I do believe that kind of money will follow. I think there's this kind of double-edged sort of this fixation on funding because there's a funding gap, like we've just talked about for the last 40 minutes. But as a result, sometimes that comes out at a distraction actually of building an incredible product and business. And so in my work, spending time with early stage founders right now, I love to really focus and get in the weeds on the business fundamentals, how to build an amazing product, figure out who will pay, all that other stuff. And if you can do that, I guarantee that there will be capital, there will be bias and challenges along the way, but there will be people that will support you getting access to that to really help leverage and build on top of the amazing product and business that you've built.
I would say from a design perspective, going back to really design for that specificity where you can. And I would say 3 things. So not just build for their clinical outcomes, but for women's preferences that will help adherence, that will help engagement. Embed those trust signals. Women want trusted info. They want trusted spaces. They're telling us that. And then also, Carolyn, you were talking about this earlier, any type of clinician connectivity, build that into the core of your model. And those 3 things, we are finding it is what women are raising their hands and wanting more of. And I think that will help you grow with or the dollars, right? Like it will help you grow or get off at least to a good start. And so, yeah. And we're all in your corner.
Yes, we are. Well, happy National Women's Health Week. Women's Health Month. We are going to continue to celebrate all month long, no matter if HHS is celebrating with us or not. Thank you, guys.
Thanks, Callie.
Thank you.
Thanks, Carolyn. Great to see you both.
Thanks for listening to The Heart of Healthcare. If you enjoyed this episode and you'd like to support the podcast, please leave a rating and review. And don't forget to subscribe. The Heart of Healthcare is produced by Hallie Tecco and hosted by Michael Esquivel, Steve Krause, and Hallie Tecco. The show is engineered, edited, and mixed by Kyle Moore. Visit our website, heartofhealthcarepodcast.com, for show notes and details.
Are you looking for a new job or want a career change? Look no further than Monster.com. Need a little help standing out? Our expert resume writing services will make sure you shine. Want to brush up on your interview skills? Engage with our AI interview prep tool. Want some advice on negotiating your new salary? Visit our salary tools and extensive library of career advice articles, and you'll have all the tips and tricks you'll need to succeed. Visit Monster.com today and take the first step towards your career. Monster.com. Find your right job fit.